Well, we're here with Dr. Martinez in Chicago. Actually, she has 3 offices. One is in proper Chicago, in Aurora, and one is in Joliet. Hi, Dr. Martinez.
Hi, how are you?
Good. Dr. Martinez, let's get to the point here. There's lots of people out there who they have a missing tooth or two, and mostly in the back, and they haven't fixed them for a long time. And apparently nothing really bad has happened. It's just not a big handicap, and yet every dentist like you keeps saying we got to replace those teeth as fast as possible. What's the story there? On one hand, nothing all that bad is happening after a bunch of years, and on the other hand, you dentists are very eminent about getting them fixed. Is it just a money thing for dentists, or is there really something to it? Can you shed some light on it?
Sure. Are you saying that nothing has happened based on just because you don't see it or it doesn't hurt? Is that what you're asking?
Yeah.
Okay. See, the changes that happen with teeth when we extract teeth that we're not supposed to extract, as I put it, the mouth is like a puzzle. Just like a puzzle you have. When you pull out a piece of the puzzle in the middle of the puzzle, what happens? The puzzle starts losing its shape and its form. The same thing happens with the mouth. You don't feel it, you don't see it, but it starts losing the shape. The teeth start collapsing. This creates problems with the ligaments. This creates problems while chewing. And the symptoms or the feelings that you're having that are changing, because it's not causing severe pain in most cases, people just get used to them. But the bite does collapse. The muscles, the ligaments do start seeing some changes. And eventually, the puzzle falls apart. And that's what happens with teeth.
I see. So if I compare that to from my previous lifetime in engineering, if you have like hinges or cogwheels which become eventually out of a line, eventually the machine goes and it comes to a stop. So looking at it that way, is it true? Is it maybe possible? And I can see that, like if you have a door with hinges and one gets crooked. Number one, is it possible that actually faces over time become slightly deformed, little crooked, little this, little that?
Definitely. It's the same thing with any muscle, or you're putting a undue strain on a ligament and a muscle, you can start walking differently because you're starting to lean in favor of where you're not feeling well. The same thing happens with the mouth. We start chewing on the other side more than the other side because we don't have that crucial piece of a molar. And so we start chewing on the other side. We start wearing the other side more. And what I mean by wearing is overwearing. Again, teeth were meant to work as a function, as a unit. When you don't have that unit complete, the other teeth start doing the function of the other unit. Meaning, if you already have a weakened tooth on the other side, and you're putting it to work overtime because you're not using the side where the extraction was done, where the tooth was pulled, you're overworking. I always tell my patients, it's kind of like sending a little old man to work overtime. And we don't want to do that because you're not going to last as long. And so then that's where it becomes so important that you have a complete set of teeth, a complete functional set of teeth, so that you can give it all the best possibility of your mouth to function properly.
I can see that. So when the way you're speaking, it looks to me it's rather possible that some people who have headaches and maybe tensions in their neck and shoulders, that there could possibly be coming from the mouth, the teeth being out of alignment, being not being crooked and basically falling apart. Yes? Definitely. I mean, it could be because they're falling apart because they're missing teeth. Actually, it could be because they're what we call clenching or grinding their teeth. It was thought that it used to be from stress that we were grinding our teeth at night. But then I've also have patients that ask me, why does my 3-year-old grind their teeth overnight? All the studies that I have read, it says that one of the reasons that we grind or clench our teeth is because we're trying to open up our airway during the night. So either you have allergies or you have problems with the airway breathing, like asthma, and so that's why we clench and grind our teeth. And that is really detrimental. That really causes a lot of problems to the head and neck area.
And and it's funny because people don't realize that the mouth is very much connected to the rest of the body. People think that it's just teeth and that's all that you need. It's teeth. They're not that important.
Teeth and good looking.
Exactly. But it really is not. I mean, it's really a function of how we function as a whole body. And when something is not right in your mouth, there's repercussions in the rest of the body.
Wow.
And I see it all the time. I've been doing this for too long, and I see it all the time.
Well, very obviously, I think people in that case listening to this video should take notice that if maybe perhaps they have had headaches and shoulder tension and other tensions in their body, especially around the neck, they may have tried to get rid of headaches with aspirin or whatever else, and it doesn't go away. Maybe it's time to go and look at a dentist and see whether everything is straightened out.
Sure. You know what? And if it's not the problem, that's fine. But this way, you know that you are tackling whatever way you can.
Right. You gotta. I guess that is the way of examining things in the first place, by elimination, right? You eliminate.
Exactly. The process of elimination.
Yeah. Okay. Well, absolutely wonderful. I'm sure this video was helpful to people watching it. Thanks a lot, Dr. Martinez.
Thank you for having me.
You're welcome.